I received wonderful care and support from my GP in the surgery during a long illness. Following that, I wanted to contribute to the surgery, so I joined the PPG.
Yeah, the patient participation group is the patient's voice in their local GP practice and the NHS to influence and help implement changes, to act as a critical friend to the practice and a conduit to channel patients' views on changes to the GPs in particular and the NHS in general. This short film utilises some of the key things to think about when setting up a patient participation group.
For recruiting, it's essential to have the full support of a practice GP and the practice manager, as membership of the group is limited to practice patients. However, members of the practice staff and from other organisations can be co-opted onto the committee. Initially, Dr. Perkins communicated to patients who he thought would be interested in forming the group. From this, a committee was formed. Further recruits were approached by committee members, while others volunteered from publicity in the surgery newsletter, village magazines, the website and public meetings. There is, however, a problem getting younger people to join the group, and also difficulty in recruiting patients to join the virtual group. Finally, it's important that the group is not used as a forum for complaints. These are dealt with through the practice's normal channels.
Having encouraged members to form a group, the next thing is to establish a simple constitution for the operation of the group. The second thing is to join one of the national organisations, such as the National Association of Patient Participation Groups, or NAP, which will allow you to get information from a national organisation and also to import your own thoughts to them and act as on a united front when it should so be necessary. The third item is fundraising. You need to establish whether you're going to be a fundraising group. We are lucky in the fact that the Westbank Healthy Living Centre provides us with free meeting rooms, and our practice supports us with small monetary funds when we require it. These things vary from group to group.
To run meetings effectively, you need a chairman to preside over proceedings, a secretary to record and produce minutes, and at the very least, if you raise funds, a treasurer. There should be a set agenda for each meeting and a slot for any other business to allow everyone to introduce items. How often you meet depends on what you do. If you're planning projects corresponding with third parties, etc., monthly meetings keep everyone up to date. Try to distribute minutes within a week and send out the agenda for the next meeting 1 week before. You may be surprised, but in any group of people, you will find willing, knowledgeable volunteers. Value them and keep them interested.
Practices often give groups space on their website where you can publish agendas and minutes and post a space in the waiting room. You can also put regular newsletters in local magazines and papers and have a Facebook page.
Our patient participation group is made up of patients who act as critical friends. It became apparent to me how passionately our patients cared about their medical care, the practice, us as GPs, and all the staff in the practice, while always acting as insurance, protecting the best interests of our practice, especially during times of change that's occurred in the NHS since and in primary care. The group now heads up our development into the next period of healthcare change, ensuring continuing high-quality general practice. I passionately believe that working with patients in partnership at all levels is the only way communities will be able to provide services that will support health and well-being in the future. For me as a GP, it has been an intensely rewarding experience developing a trusting relationship with a group of patients who have worked in partnership with the practice over the last 8 years.
Involvement in the patient participation group brings a sense of ownership and inclusion in the practice. Patient participation group action can result in improvement of practice provision and facilities.
The group explored ideas to enliven the patient's experience while waiting for their appointment. As several of our patients belong to a local art club, we decided to display some of the work on the walls at both of our surgeries. This brings together all the patients, some to decorate the waiting rooms and others to appreciate their work.
There can be opportunity to learn about specific conditions and the management by professionals at public talks for the benefit of the whole local community.
Groups of this nature provide health promotion, increased knowledge and peer support. Wider benefits of patient participation group membership are the debates and discussions which lead to a greater understanding of health and social care services and how they are currently developing in a period of consistent change. Looking ahead, it's hoped that the patient participation groups will develop strong links to the clinical commissioning group and have a voice in commissioning local services.
Forming a group is a challenge, but the benefits to the patient-practice partnership are worth it and can be immense. A little effort and time gains mutual understanding and respect, new ideas and suggestions from a different perspective, and enthusiastic support. To recap, the things to think about when setting up a PPG are how to recruit members, setting up the constitution, national body membership, when and how to fundraise, appointing officers, and organising regular meetings. There is no doubt that with the current growth of patient participation groups, plus their recognition by clinical commissioning groups and within HealthWatch, that through them, the voice of the patient will be heard and respected in helping determine future services on a regional and national basis.